So, you might have seen a pretty alarming headline making the rounds about a huge new tax on medicines. Today, we're going to break down what that really means for you and your pharmacy bill. Let's get right into it. Right. Here's the headline that's got everyone talking. The U.S. has announced a staggering 100% tariff on pharmaceutical imports from India. And, India is one of the biggest drug suppliers to the United States. This is all set to kick in on October 1st, 2025. Now, a 100% tariff, that basically means you're doubling the cost to import something. And yeah, that immediately brings up the big question, doesn't it? If the import cost doubles, does that mean the price you're paying at the pharmacy is about to double too? It's a really scary thought for sure. But the answer, well, it's a lot more complicated than you might think. So let's pull this headline apart. With any big policy like this, it's always the fine print that really matters. And in this case, it's absolutely crucial to understanding what's actually going on here. Okay, here are the nuts and bolts of the executive order. It's a 100% tariff, it kicks in late next year, and the stated goal is to bring drug manufacturing back to the US. But look at that fine print. This tariff is super specific. It's not a blanket tax on all medicines from India. And honestly, that one little detail changes absolutely everything. The whole story, the entire thing, really hinges on understanding one simple but vital difference: the difference between branded medicines and generic medicines. This is the key that unlocks what this new policy is all about. And check this out. This chart tells you pretty much the whole story in one picture. A massive 90% of the pharmaceuticals the U.S. imports from India are generic medicines. And guess what? They are totally exempt from this new tariff. That 100% tariff only applies to that tiny little 10% sliver of branded medicines. It really just shows you how targeted this whole thing is. So let's be crystal clear on this. Over here on the left, you've got your generic drugs. Think of the active ingredient, stuff like ibuprofen or metformin. These are the low-cost, off-patent workhorses of the medical world, right? And they are completely safe from the tariff. Now on the right, you've got branded drugs. Those are the patented, trademarked products sold under a specific name. They're often the original innovator drug. These are the only ones getting hit with that 100% tariff. So what's the actual impact in the real world? Now that we know who is and who isn't being targeted, we can kind of follow the money and see what the real consequences are. To put this 100% figure into perspective, just look at this. For years, pharmaceutical tariffs have been basically zero, to make sure medicine can get where it needs to go. Even those big recent tariffs on steel and aluminum were around 25%. This new 100% tax on branded drugs is like a surgical strike. It's incredibly precise and unusually high, which tells you it has a very specific goal, not just a broad trade action. So who actually feels the pain here? Well, it's a really narrow group. Companies in India making those specific branded drugs for the US are going to get hit, and we might see their stocks take a little dip. But, and this is so crucial, the huge majority of the generic drug supply chain is completely untouched. Even the raw materials, what they call active pharmaceutical ingredients or APIs, they're exempt too. Okay, to make this even clearer, let's stop talking in these abstract categories and let's actually follow the journey of a single, super common pill that, let's be honest, a lot of us probably have in our medicine cabinets right now. Let's talk about paracetamol. You might know it in the US as acetaminophen. India is a massive global supplier of this stuff, and it's just the perfect example of a generic drug that millions of Americans rely on every single day. This table really breaks down the cost. A single tablet costs what, about a penny to make in India? By the time it actually lands in the US, it's maybe 2 cents. After all the markups, it sells for about 8 cents. Now look at that import tariff line, it's zero. Because it's a generic drug, it faces no tariff, and this new policy doesn't change that one single bit. And that 0% tariff on generics like paracetamol, well, it leads directly to this number. This is the bottom line for us, the consumers. This system of importing low-cost, tariff-free generic drugs saves American consumers an incredible 70 to 80% compared to what they'd pay for the branded versions. That is a massive, real-world benefit that remains completely protected under this new policy. All right, let's tie this all together and circle back to that first big question. What does all this news actually mean for you? Here's the big picture takeaway. So, the most important thing to remember is this. That scary 100% tariff is really just a surgical strike on a tiny 10% part of the market.
the branded drugs. The other 90%, the generic medicines that make up most of our prescriptions, they're not going to be directly affected. The supply chain for drugs like paracetamol, metformin, atorvastatin, it's safe. This is way less about raising your cost and way more about putting pressure on companies to make their high-profit patented drugs right here in the USA.
Which, it leaves us with one final question. We've seen that this tariff probably won't impact most of your prescriptions, but the goal is to boost domestic manufacturing. So the real debate isn't about your immediate costs. It's about whether a policy like this is really the best way to get to that long-term goal. And that's a question that's definitely worth thinking about.